Hello, and thank you for joining me. Hello, everyone. Welcome. I'm so excited to connect with everyone tonight. Our event here tonight, the goal of this is to share a lot about where we stand, the state of functional nursing, which I'm really excited to share a lot of that with you. So, welcome, everyone. I am so grateful that you've joined us. The goal of our time together is to share some thoughts about where functional nursing stands right now and where it's headed and how we can shape it together. So, thank you for being here. And for those of you that aren't familiar with me, I wanted to just introduce myself. My name is Brigitte Sager, and I am a family nurse practitioner. I was originally a critical care float nurse. I worked in my local hospital for about 8 years, and then I became a primary care provider for about 4 years. And I have been a functional nurse and functional nurse practitioner for many years now. I teach functional medicine to nurses and nurse practitioners. I teach nutrition and entrepreneurship. And I am speaking to you from the Institute for Functional Nursing. That is our platform where I will be sharing some of my thoughts with you today. But at large, I feel that in my time teaching functional nursing, I just have been learning a lot about nurses and what we can do to maybe do a little bit about our healthcare system and do a little bit about how we feel about our work and how it aligns with our values. Nurses everywhere are asking how they can offer something more in alignment with who they are, and they like the care that feels authentic for them and meaningful and sustainable. That's conversations that I'm having with nurses every day around this topic. I believe it's up to us as nurses too to take on a role as like the advocates and leaders and to push for some of the change that really needs to take place in our healthcare system, not just for ourselves, but obviously as well for our patients and our communities that we're serving in. So I wanted to kind of start by talking a little bit about the big picture and healthcare overall. I think we all know that there's some room for improvement. I think that like nurses are really underutilized in our current system in a lot of ways, and I think that there are a lot of things that patients are becoming more aware about. They're looking for better answers. Patients are saying, like, people are telling me my labs are all normal. I'm being told that I'm fine because I don't have a diagnosable health condition. And then meanwhile, we know that they're in functional medicine, functional nursing, we know that there's something better that we can offer. And patients are starting to really look for it. The demand for functional healthcare has like just exploded. Many, many, many students have told me that the clinics in their communities have extremely long wait lists or they're taking no new patients. When I first started teaching functional nursing, my first few cohorts, and hi to you guys if you're on here, we would talk a lot about how nobody knew what we were offering or what functional nursing or functional medicine was. And now in my most recent cohorts, we launched cohort 16 today, that these cohorts are talking about how people are excited for them to finish their functional nursing education and start offering their services. A lot of them are in communities where there isn't something similar available. And so they are able to offer something to patients that otherwise might not have access to a more holistic approach in healthcare. And I think at large, I just really feel like nurses are the bridge to solving a lot of the problems in healthcare. I see many more nurses stepping into offering group visits, stepping into their full scope, and realizing how much patient education really can move the needle for people compared to just refilling their prescriptions and waiting for them to get diagnosed with a chronic health condition to prescribe or intervene. There's a lot more continuity, we know, when we have nurses involved in patient care. And there's also this like expanding access. And that's a big issue that I'm going to talk a little bit about in functional healthcare. I wanted to share with you some of the real world examples of like what I'm seeing nurses do that are learning functional medicine. A lot of my students are working in integrative and functional clinics. They're often running groups or doing some of the lifting, onboarding patients with which otherwise could be really challenging or is. We often say that functional medicine is really expensive and is inaccessible to some people, and it's a real strain on provider time. And that is how it's kind of shifted to being a cash practice offering typically. And I do absolutely believe that functional medicine can be offered in an insurance model. I have done that when I was in primary care and was incorporating it. I have many students that have done that. Our faculty at IFN, some of them are accepting insurance. There's absolutely ways that we can get creative and make this more accessible. And I really think that nurses are the way to address those problems because we can reach many more people when we're offering groups. There are a lot of themes in functional medicine that come up frequently that nurses could be running groups for in these clinics that are really overwhelmed. They can also do a lot of the intake part that at the moment a lot of physicians and nurse practitioners are doing. I've been thinking a lot lately about like who checks a patient into the hospital and gets them onboarded when they need to be admitted. Who does that in a primary care clinic? It is not the nurse practitioner or the physician, right? And so like how has that gotten missed in shifting to functional medicine? And I really think it's that unfortunately, I don't think a lot of people really understand the scope of nursing professionals. And so, as much as I am going to share with you some of the things that my students are doing, it's also a challenge to we're going to have to shift how people view what we offer and also getting in front of these folks in these clinics that don't understand our full scope and what we could be doing for them. That is still a really big challenge. So I think if we're talking about the state of functional nursing, I think awareness is really high on my list because people aren't always aware of just how much we can offer for them. And these providers that are overextended could really benefit from using functional nurses in their practice. And I don't think that light bulb has gone off universally. I talk to IFM regularly. The Institute for Functional Medicine is our partners with IFN, and we talk regularly. And I think that like that's one of my biggest goals is just to create more awareness around that topic of like nurses solving these problems. I really think that we're the solution and that nobody's going to advocate for us, right? It's going to be a lot of us having to do that. So when we step outside of those practices, other things I see a lot of my students doing, I've had entrepreneur students that have worked with me to build their practices, but I've also had students like in the membership, in the cohorts that I've taught that have started their own practices. And I just wanted to give you a couple examples. A lot of folks are working with people around like gut health or cardiometabolic health. If you hear me talk very much, I host the Functional Nurse podcast. So if you haven't heard that yet, you can go hear me ramble about these topics. But niching, I think, is really important when we're talking about running a business. And so, wellness doesn't typically land very well for people knowing that you could help them. So these niches I'm sharing with you are really lovely because it's a way for us to let people know how we can help them. And I've had several nurses that are working in cardiac rehab, which is near and dear to my heart because I worked on a cardiac unit for a long time. And I really understand that those patients really, a lot of them are motivated and want some support. Perinatal care and fertility and infertility is a big topic. Stress and nervous system regulation is a big topic, and holistic nurses are really good at that, like helping people with things like mindfulness and just resetting their nervous system, understanding the impact their nervous system is having on their health, brain health. And sometimes that goes into the pediatric world and like helping to address concerns like autism and ADHD. And functional nurses are super equipped to help people with those concerns. And this idea of us offering something different and something better for our patients isn't like just a theory. I hope like these examples are showing you like it's happening right now and nurses are stepping into the functional space and really changing their patients' lives, but also they're doing a lot about aligning more with why they were called to nursing in the first place, which is I get really excited about. I think more and more nurses are realizing that functional nursing isn't just a skill set. It's like a way to practice in alignment with your values and your purpose and the kind of nurse that you want to be. I think that's something that has been a problem for a lot of nurses in the last few years. I even feel like the term burnout doesn't sit super well with me because I think that the truth is that a lot of us have just been practicing in a system that we don't align with, and that it isn't that we don't want to be nurses anymore when people step away from the bedside. It's more that people are not feeling aligned anymore. And like the work they're doing is the reason they came to nursing in the first place. And I want to take a moment now to frame the distinction between functional medicine and functional nursing. If you hear me using them interchangeably, medicine is And if you hear people say, like, oh, that's not in a nursing scope, right? Nurses cannot prescribe medications, right? Nurses are not performing surgery. Nurses are not doing things that are in a medical model. Nurse practitioners often have the ability to do that depending on their scope, and that really depends on where they live and where they're licensed. But in the very first cohort, when I started teaching functional medicine a long time ago, I remember making the course and feeling kind of weird about writing the word medicine all the time because I had had this light bulb moment when I was learning functional medicine that it was really like acknowledging holistic nursing. And we're not talking about that enough. Like that functional medicine, what people are starting to say, oh my gosh, this really helps people. It's what we were taught to do in nursing school that kind of just gets pushed to the side when we get to the bedside and we turn into frequently task doers. We're just trying to get patients to take their medications, get them off to their procedures, get them imaging, get them to be compliant with somebody else's plan for them. And, people will say nurses can't diagnose, and I could go down a rabbit hole for that, but I do just want to acknowledge that we have nursing diagnoses, and I have had over 1,000 nurses do a deep dive into their scope of practice and come back and share that with me. And nursing diagnoses are in your scope of practice, and they align super well with the ideas of functional medicine. So in that very first cohort, in one of our very first meetings, somebody brought that up and said, this just feels more like it should be called functional nursing than functional medicine. And I 100% agree. Medicine is more if we're like writing prescriptions and doing a whole bunch of like interventions for people. But what functional nursing is really about is providing the education and support and partnering with our patients and making connections for them that often people just don't understand. Like I mentioned, stress and sleep. And if they just keep being told to refill their medications for like brain health concern, and they never get the connection that like their sleep hygiene and their stress response and maybe some past trauma that hasn't been addressed, that all of that might be the root cause of their health concern. So a provider can give them a prescription and give them a medical diagnosis, but we don't care very much about medical diagnoses in functional medicine. We care about the root cause. And that's truly like where nurses shine because we are experts at getting a thorough intake on our patients, looking for a root cause and providing education. I think all nurses are experts in educating patients and partnering with them. And so functional medicine gives us that opportunity to really like do that for our patients and also acknowledges how incredible it can be for outcomes for our patients. So we are calling it functional nursing at IFN, and I think that that's really wonderful. And I just think with so many nurses moving towards this type of care, I feel that functional nursing has the ability to address many of the issues we're facing in our healthcare system. And if we want it to change, I just feel like we can't wait for the system to fix itself. I have been shifting more towards like focusing on advocacy and talking to nurses about health policy change. Nurses are the largest segment of the healthcare workforce. They're the largest movement coming to functional medicine. IFM reports that nurses and nurse practitioners are the largest body coming to this area of healthcare, which is really exciting and perfect. And that gives us this unique responsibility too, right? Being the largest number of healthcare practitioners and then being the largest body coming to this area of healthcare, it gives us this responsibility and power to shape what's coming next. And advocacy is going to have to be a part of that role. And what that looks like for each of us is different. I think sometimes, I'll have students tell me when we're talking about this in the course, like, oh, I'm not political. And it does not at all have to be political. It can be, but it can be you finding out who the right person is to talk to in your hospital system when you care about the food being served to the patients. It can be about reaching out to your school board and talking about the food that's being served. I'm really big into the farm to school grant program in the United States, and that's farmtoschool.org. And that's about getting local farmed foods into the school systems and teaching children about real food. So there are a lot of many, many examples, and there are some episodes on the podcast if you're interested in that topic, but all the way to being a lobbyist for healthcare and going to your politicians that they have other people in their ears that do not have our perspective, don't understand healthcare the way we do. don't understand the patient experience the way that we do, and they make their decisions based on who's in their ear because they're not experts in all these topics. So you can reach out to your local politicians, national politicians, offer to be a resource for them or give them some information on a topic that you feel passionately about. But I think that overall, like, the take home message from that part is just like nobody's going to do this for us. Like, we really have to accept the fact that if we're going to improve healthcare for the better and create more awareness around the problems that nursing professionals can solve, if we shift healthcare a little bit, then that's on us. And each of us, I think, really need to do our part. And so that brings me to a question that I get all the time that I think a lot of you on here have questions about. What about certification as a functional nurse? And I want to kind of zoom out first and talk about what certification means. People often ask me, like, when can I call myself a functional nurse or a functional medicine nurse? And I just like to reiterate when that comes up, like, we don't call ourselves, like, when I worked on a cardiac floor, I was a cardiac nurse. If somebody asked me what I did, if you're in an emergency department or you're a school nurse, that's who you are. That title is about what we're offering our patients. But certification matters in that it's this ability for us to bring distinction or credibility or give some recognition to our skills and like the additional education we've done after nursing school. Like, we have like become an expert in a topic. And our partners at the Institute for Functional Medicine are like without a doubt the leading voice in functional medicine and certification. And right now, their program is their only pathway that counts towards the certification that they offer. And what happened about a year and a half ago, they had like heard the feedback and said people want options for the non-prescribing providers like dietitians and chiropractors, so health practitioners. They're going to create two pathways, right? And that you don't necessarily need to do their program to take that test. They announced that, and there's still a lot to be sorted out. I think this is certainly at the moment the most credible and respected avenue to certification at this time. The testing, though, is not like specific to RN or NP scope of practice. Me and all the other faculty at IFN have all taken the board certification, even looking at the competencies for when it does move forward. I just want to acknowledge that it isn't going to be specific to nursing and NP scope. It's going to be two tiers, like prescribing providers and non prescribing providers. So, like, a mental health practitioner will be taking the same test as an RN. So, that at the moment, because of our partnership, I'm meeting with them regularly. And I think what's on the website is the most up to date information. If you go there, they update that when they have new information. You may have noticed on their website that they mention the outside programs may be able to test for certification at some point, but the timeline is really uncertain and potentially far off for the programs outside of IFM themselves. Although we had hoped to have like really clear information for nursing professionals tonight, the reality is that that path may exist in the future. I don't know what that looks like, but right now there aren't any guarantees, and I don't want to imply that there are. So I wanted to be really clear about that. And we can't make any promises on what IFM will do or their timeline for that. And so that sadly is my update. This is one of the reasons that I kind of want to talk a little bit more about board certification. I mentioned before, like, critical care nurses get a board certification, school nurses can get a board certification, like whatever your specialty is in nursing, you can get a board certification in. And this is why we believe that the long-term solution is really to have a nursing board certification in functional nursing, and that be done the way that we've always gotten board certified in nursing. If you're an FNP like I am, you're a family nurse practitioner, you're board certified in that. That test is through certifying bodies that understand nursing scope and nurse practitioner scope really well. So regardless of the IFM timeline that I just sadly I don't have any control over, and I don't think I want control over, but I don't know what the timeline is or what they're going to say when it's all done. I just want to acknowledge that, like, I think it's time for us to advocate for nurses getting the credentials that recognize their unique role in the functional health space. So, our intention moving forward is that we want to advocate for getting the functional nursing certification wheels turning. That's generally a process that takes several years, also. And that I think that needs to happen. We've been talking about it in my cohorts for a few years now. And this has been similar for many fields of nursing where they emerge and start to gain some credibility. And then nurses want board certification in the training they've received. So I think it's time for us to start that process. And I want to talk about the word certification a little bit more too before we move on. Is that I can make a program today. And when the program that I have been teaching for the last several years, people would ask us why there wasn't a certification at the end. And the truth is, like, I can make up a test at the end of something and tell you that you're certified in it. And that is what all the other programs do. But that just doesn't align with who we are. That has never felt right to me. Like, any program can make up a certificate and write their own test. And that's just not us. It's not going to be us. We're not going to do that. So, and I mean, that's why IFM is creating a separate body to be their certifying body, because it's respected. And, medical physicians get board certified just like we do through a medical board certification. And so that's what's taking place, is they're separating their education platform from the actual certifying body, and it's a medical model. You can find places online to get your program called board certified through a third party, and that isn't necessarily through nursing or through healthcare or through anybody that understands our scope. I can't think of a single program that has created one of those that understands nursing scope or has, like, trained, skilled providers that are graduate level IFMCP certified, functional medicine trained nurse practitioners and nurses that are creating those questions and understand what that entails, and like how to certify nurses and nurse practitioners. So no, we're not here to create a test so that you have the piece of paper, just like I've always done. My students get a certificate at the end. It says how many contact hours they got. That is all approved through certifying bodies like the American Holistic Nurses Association, AHNC, ANA, like that whole umbrella of respected nursing certifying bodies is what our focus has always been and will continue to be. We are really committed to building something credible and aligned and recognized through legitimate nursing certifying bodies as we're creating our content. And so that whole process is just getting started. It's going to take time. It's probably going to take several years. And I know that sucks. So it's hard to say whether a nursing specific certification or the new IFM credential with the RN level path that would be with the other types of practitioners is going to come out first as the clear option for nurses that don't want to do IFM's full program to take the test that they're going to offer. So I want to now kind of shift to like who we are at IFN and what we're trying to do to address all of this that we're talking about. So instead of focusing on like what we don't know yet, I want to talk about what we do know. And that is how IFN, the Institute for Functional Nursing, can support you right now to learn functional nursing, to shift into a practice that it feels aligned with your values and offer patients care that's deeply fulfilling and true to your calling as a nurse. IFN has been established because I feel like there's been this need to translate functional medicine into nursing language and create a professional home for nurses. I previously had been teaching it for about the last 4 years, but it wasn't a full program that would get you a full training. It was more like an introduction. That's kind of how IFN came to be, is just from like more and more nurses coming to this and having the demand, and IFM not having plans to create a separate training program in the language of nursing. Our partnership with IFM is a way that adds credibility to who we are. We are their nursing partner. It shows nurses that IFM really is respecting the role of nursing in this area of healthcare. It's recognizing us in the functional medicine space. They are really supportive of our RN and NP members that we have in our membership. And we're able to share the discounts that they share with us with those nursing professionals to use for IFM's offerings through our membership. So sometimes people might sign up for our membership to have a supportive area to learn functional nursing, and then they can do IFM's programs at a discount. So that's one way that you may choose to work with us. Our current offerings include shorter continuing education courses. So if you are like looking to get your feet wet in functional medicine, or understand a little bit more about what functional nursing is, we have our evidence-informed, accredited courses. We have immune health, a hormone health course, and another one come in early next year. adverse food reactions course, which is a really great way to learn a little bit more about this land of functional nursing. And then we have our intro course that's going to be a bit more robust for nurses that want to have a pretty good idea of what functional nursing is. That's coming very soon. For that one, there is all of the others you can go sign up and start today. That one is there's a wait list until we publish it in the very next few weeks. So membership, I will share more with you in a minute. Our full program, we were trying to like wait and see what IFM had coming down the pike as far as like the certification information, but we have decided that we have a really big wait list of nurses. I understand that you guys have been waiting for more information and wanting to get started, and that list just keeps growing and growing. So I'm feeling like we need to just get started. The full program is launching in early 2026. What I know now that I can share with you is it's going to be 2 semesters long. Our goal is to align it with IFM's competencies that they have shared, and it is going to be a comprehensive nursing focused curriculum. It's going to be taking functional medicine, translating it into nursing, and applying it in our RN and NP scope. It's going to have lots of case studies and interaction for you to feel supported and understand how to use this in your practice. The interactive part is one of the most important aspects to us, is that you aren't just watching videos and walking away with content, but really feeling like you understand how to apply it. I know that I like had hoped that we would go live and have like full details and insights, and I don't have all of those, but I wanted to share what we do know tonight. Our goal is for it to be 150 to 200 contact hours and to be 2 semesters long. It's going to be starting in the first few months of 2026, and it is going to be priced very fairly, especially the first cohort, for content that is aimed at providing nursing professionals with a comprehensive education and functional approach. We're going to have early bird registration with discounted tuition and payment plans that are going to start in the fall. And so if you want to get in early to save money and get your spot locked in, that is going to be coming out in a few months. And at that point, I will have all the answers for you, I promise. We're going to keep our members and our wait list fully informed. So the best way to stay in the loop for this is to be sure you're following us on social media and then to sign up on the website. So fxnursing.com is the best way to get more information. You can sign up for the waitlist for that program there. On that actual programs page, the functional nursing program, you can see our FAQ section, and we update that regularly every time we learn something new about details for the program. So then the membership is the big thing that we have going right now. And we started it at the end of last year. And so we've had many nurses and nurse practitioners join us, and we have a wonderful group of faculty. I wanted to tell you a little bit more about that before we're done. So each month we have 4 live calls. We have case study calls. We have student-led case studies where a student may choose to present something either that went super well for them or they're feeling stuck on and they'd like some support. These are all live where the other students are jumping on and we're all having an open discussion there. And then twice a month, we have open discussion topics, and we kind of like wait to pick what those are going to be until topics emerge that students are really interested in. If we, for example, present a case study and it creates a lot of questions around a topic, then we'll have an open discussion about that. We have a directory that's going live in the next week or so, and that is going to be an outward facing place that long term will grow and be a source for nurses to find each other, nurses to find people to send their patients to in their area, hopefully, and then also for people looking to hire, that nurses can mark that they're seeking employment there as well. Part of the membership includes the IFM discounts I mentioned. And one great thing about it now is it's been going on since the end of last year. So we have all the recordings from all of our meetups that we've done this whole year are available for when people join us. They get to access all of those recordings. And then it's just a really great place for support from peers that are a like-minded approach to their nursing practice, and faculty support as well. And our faculty, I just feel like I'm so grateful that they have all joined us. Everybody has been trained through IFM and they're IFMCP certified. Everybody has a graduate degree. That is a big take home for me. If you're looking at other programs, is like, who is training you? You know, we all have a passion for education. I have a background as a nurse educator and I'm a board certified nurse educator. that is not something that you get lightly. Like, I did a lot of training and have taught nurses in the college setting, developed curriculum. I've developed several programs now. I think that you really have to look at programs with scrutiny to see how they were developed and who is your educator. I think it's a really good question. So I feel very lucky that we have faculty that is just incredible. They light up the students. They all come in with their own practice and experience building their own practice, but also a different niche of functional nursing that they are sharing as well. And if you're curious, you can, on the membership page, it shares the bios of all of our faculty if you want to take a look at that. So, one of the reasons we did the go live today is our membership is locked most of the time so that we're not distracted by people coming and going, and we can really nurture the students that are there. And we only unlock it like a few times a year. And so it hasn't been open for anybody to join us in quite some time. So it is going to be unlocked this evening through Sunday night at 11:59 Pacific Standard Time, just because that's my time zone. If you want to join us, now is an opportunity to do that. Our current students are going to be grandfathered in if they have a monthly plan, but from now on, we're only going to be offering an annual subscription with a payment plan if you need it. And the reason for that is because we do pay in our partnership with IFM to give you access to their discount program. And so that is the reason for that, so that you are accessing that and you need to be with us for the year, not just for a month. When you get in there, you have immediate access to the recordings, which is a full library of videos now. You can immediately sign up for the IFM discount feature and go ahead and plug in your information for the directory. And I am extremely proud of this because we've put so much thought into it. And I take feedback from students very seriously. So we've, had our 16 cohorts of the smaller program that I've been teaching. And one of the things that people were asking for just time and time again was like, they love the program, but they wish there was more like applying it in practice and ability to connect with peers and live discussions. We would have really great meetups about once a month and connect during that course. But being able to do it every week is just like, or not every week, but 4 times a month is just, it's really special. And our group that we have in there now is just incredible. I love our students so much. So I just think this is a really special space for nurses in the functional nursing, functional medicine world for support and connection. And I think that's lacking in a lot of programs that I've been through and in society at large. I think people want to feel more connected. So I'm really happy that we're able to offer that. Okay, so if you are interested in that, fxnursing.com, you can go over there and sign up. You can get on the wait list for the full program. You can see our short courses that are currently available. You can get on the wait list for the Intro to Functional Nursing course. I've heard some of you, say you want somewhere to send your nurse friends that want to learn what you've learned. So if that is the case, the Intro to Functional Nursing course, that is our current priority, is to get that launched so that you have somewhere to send them. And then I wanted to mention that in the first week of November, from November 4th to November 6th, we are going to have a summit where we're going to have a bunch of speakers, nurses, and different experts in areas that can really support the topic of redefining the future of nursing. And so I'll be speaking. A lot of my nurse and nurse practitioner friends are coming to speak, lots of different niches and specialties, as well as many industry experts. You can go to fxnursing.com/summit to sign up for that. If you want to get on the list to be informed, we will be posting about the summit in social media. I think it's going to be a great place for us to kind of hear lots of different ideas about how we can use our nursing skills differently. And that is really everything I had to share with you tonight. This is really more than just our careers. It's like, I feel like we're in this like really special place of reshaping healthcare with nurses at the center. If you want to learn more about us at IFN, I encourage you to go to fxnursing.com/learn and join us this week. If you want to just hear me ramble, because I do it, you can go to the Functional Nurse Podcast, is on Apple Podcasts, Spotify, and you can access a link to it also on our website. So I am so grateful that you all joined me tonight. I wish you the best, and I hope we see you in our courses at IFN. Take care.